Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH-accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Okay, let's talk about Scarless Gynecomastia Surgery. I often hear questions from patients during consultations about what type of scars they will get from the surgery. I can understand why they are worried about it because essentially one of the main reasons why patients come in for surgery for the gynecomastia is to feel good and to look good. And the last thing they want is have some disfiguring scar on their chest, on their breast after their gynecomastia is being treated. So, is it possible to have Scarless Gynecomastia surgery? Well, the answer is yes and no at the same time. No, it is because a scar or an incision, surgical incision, has to be made for the excess tissue, such as the enlarged glands and thickened fat tissues, to be removed to obtain a flatter and better results. And at the same time, the answer is yes, scarless surgery is possible. It is because if the scar is made small enough at the very strategic locations, such as the intersect point between the darker patch of the areola with the normal skin, then it can be concealed very well. If the healing is good, the scar heals very well. After a few months, it's really difficult to spot scars. Okay, first of all, scarless gyno surgery is not suitable for every patient. As you know, there are 4 grades of gynecomastia, depending on the severity and the size of the gland and the breast, ranging from grade 1, which is very minimal, 2, 3, up to grade 4, which is the most severe form where the glands are enlarged with excessive fat tissues, with excess loose skin. So in order for scarless gyno surgery to be carried out successfully, usually patients with grade 1 and grade 2 will be suitable for it, allowing us to get very small scar at concealed strategic location and yet getting good results for the patients. As the patient's condition gets more severe from grade 3 to grade 4, it is often very difficult to produce good, satisfying results with minimal scarless approach because it is very difficult to reconstruct the breast, to tighten the skin, to remove the surrounding excessive tissue with just very small scars at a very limited approach. For patients who are suitable, the grade 1, grade 2 gynecomastia patients, if I can describe it in more detail, a tiny scar measuring about 1 to 2 cm is made along the border of the areola, where it's very, very well concealed, and the doctors are able to approach this tiny entry point, kind of isolate the glands, take out the excessive tissue, reduce the fat layers, and stitch it up very, very nicely, leaving no marks behind. For patients who have more severe form of gynecomastia, such as grade 3 and grade 4, very often a limited approach, such as the scarless approach, may not be sufficient. Doctors may need additional incisions to address issues such as loose skin, excessive fat tissues, and such, in order to produce good results for those patients as well. How scars develop after surgery will depend on several factors. First, depends on how well your wound is being stitched up, whether or not it is infected, how good you are taking care of the wound, dressing and such. Also, what type of skin, how well the skin heals from scarring. General lifestyles, sun protection affects the wound as well. So are there anything that we can do if we develop scars or visible scars after the surgery? Yes, common issues of scars such as hyperpigmentation, thickening, keloid formation requires different treatment and approaches. If the scars appear darkened, hyperpigmented, then usually you heal spontaneously over a period of time. What kind of issues are we usually dealing with for patients who are affected by scars? First of all, pigmentations. The scar may look darker or uneven in discoloration. This can usually resolve spontaneously over a period of time. Lightening gel, lasers, creams, and other methods may help to speed up or shorten the recovery. Next, thickening. Scar may appear hypertrophic or keloidal. If there's thickening, it may take a long time for the scar to thin out and resolve. For patients who are affected more severely, for patients who have keloidal risk, steroidal injections may be required to help them. For cases with more severe skin unevenness, a surgery such as scar revision may be required. Anti-scar lymphatic massage after the surgery with manual lymphatic drainage massage may help to reduce fibrotic scar formation around the wound as well. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.